Hello and welcome to The Baby Doctor with me, Bernice Abubedu-Lansa. I'm so excited to welcome you to this program because it's been created to meet the needs of your child and your family. But guess what? Even with the advancement of science, nobody can create a child without a man and a woman. And that's why it's important that these two people are in good condition because it contributes to that child's well-being. So for our very first episode of The Baby Doctor, we've decided to focus on the two people who make it possible for babies to be born. I'll be back to tell you who my guest is right here on The Baby Doctor. Thank you so much for staying on The Baby Doctor with me, Bernice Abubedu-Lansa. Today, I've got with me Dr. Paddy Ayete. I'm sure you may have heard his name. He's well known. He's on radio because he knows his stuff. And right here on this show, those are the people we bring you to give you the best of advice, the best of knowledge on every issue we'll be discussing. Like I said today, we're looking at what happens before conception. The focus is on the man and the woman and the conditions their body must be in to create the healthy babies that we all want. Dr. Paddy Ayete is an obstetrician gynecologist at Elimas Health. Welcome, Doc. It's good to have you.
Thank you.
Right, right. So you have been working for almost, what, two decades?
Almost 2 decades.
Looking, how many, do you know the number of babies
No,
you've helped
I
women?
don't. No, I don't.
But roughly, an estimation.
I really can't
It
tell.
should be in the
No,
hundreds.
we stopped counting. After a certain age, you just stop counting because it's like, and then in our practice, there are other areas that may, appeal to you. So sometimes you spend more time doing other things than just babies and baby work.
I know.
However, I can't tell you the number. I really can't. I can't even guess.
What is the most exciting part of your job for you?
When it comes to obstetrics and babies, it is successful delivery. The mother has had her baby, and you ask, she's happy, she feels it is worth it. It's been a long journey because all the midnight calls and emergencies and all the running around just to get to where we've gotten to that day. And then she says thank you. She says thank you. And you can see how fulfilled she is. That, yes, me too, I'll be mother's son.
Yeah, I know. I know that feeling because I've experienced it.
It's really nice. And then you ask her, oh, how's your experience, the delivery? Oh, it wasn't as painful as I thought. The pain was actually not so bad. It was quicker than I thought. It was, she generally has had a good experience for her delivery, be it cesarean section or vaginal delivery, and has her baby, and it's just nice.
But Doc, I've always wondered how you manage it because women go into labor at all times. In fact, I think it's one of the most unpredictable things because you can have a rough estimation. Oh, even your due date, you don't say for a fact unless you opt for a CS or something like that. But how do you manage it? Getting calls at odd hours. You may just get home and receive a call. How do you live your life like that? I can't do that.
It is quite challenging. But when I finished school, became a doctor, and then started doing house job, and then in the early part of my residency, I worked for 36 hours straight every 5 days. Because I was on call every 5 days, and so you would work for 24 hours straight, and then if you're lucky, you get an hour sleep. Some days you don't get an hour sleep. Then when you finish, you go in the morning, present your cases, get criticized for all the work that you did the day before and didn't do right. Then you go to the ward, look after all your patients, and then if you're the one on cover, you stay till 6 p.m. or 8 p.m. when the new team would cover for night. So the end result was that we tended to work for long hours. So we got used to managing with inadequate sleep, inadequate equipment, inadequate, everything. But as you grow older, or as you rise up, there are other people who would have more of that burden. However, at any point in time, you can get called that your services are needed. I have called my bosses when I was as a resident at 2 a.m., drive to their house, bang on their door, inform them that there's this emergency, turn around and drive back to the hospital and go into theater and start the operation before they get there to come and continue. It happens. But we have a vested interest in ensuring that this 9-month journey concludes well.
Right.
And our satisfaction is in you have gotten your baby. Yeah, you can insult me afterwards. I don't care. You've gotten your baby. You are alive. Baby is alive. It's worth it.
Right.
It's worth it.
We'll be delving into the issue shortly, but I just need you to appreciate the work that Doc does and why he is the best person to be on our show today, telling you about what is most important when it comes to making babies. Why did you choose gynecology?
Oh. Okay. So there's the answer that I'll tell you in private.
Okay.
But one of the things I really liked about it, the two main things I liked about it, is that you get to practice medicine. You look after diabetes, hypertension, those kinds of conditions, hormonal problems. And you get to practice surgery. You deliver babies, you take out fibroids. So it was one of the few specialties where you could practice both medicine and surgery in the same specialty. Otherwise, my brother's a physician specialist. He just does physician work, which is the medical aspect of work. Somebody else is a surgeon. He mainly does surgeries, but he doesn't look after those kinds of things. I get the best of both worlds. So that's one of my biggest, what made the attraction to that area. The other part is that it is the part of medicine too that your patients rarely die.
Okay.
Rarely die. And the result is that your outcomes most of the time are good. I couldn't do cancer work. That knowing the fact that you're going to lose your patient, it's so depressing. And I can't handle it. So it's a part that just wasn't for me. So those who do cancer work, I really, I doff my hat to them. It's very, they may think my work is hard. I think their work is hard.
I think it's just what everybody is cut for and what they feel called to do, right? Yes. It's more of a calling for you.
ONG in particular is a calling. Because you work for people who essentially may not have much money. It's at the beginning of their life, of their economic life, let's put it that way. Whether the person can pay or not, you will still go and deliver that baby. And half the time when they can't pay, like, just go. The satisfaction is in achieving the objective, rather than if you get paid for it, yeah, we are grateful. But sometimes you just have to do the work, even though you're not going to get paid for it.
Right, Doc, let's delve into our topic for today, preconception and all you need to know about it. Let's start off on this note, looking at the male and the female and the beauty behind making babies. What at all is it about human beings that makes it possible for us to procreate?
Well, male and female, he made them. And as a result of that, that's the requirement to make a new child. You need a baby producing gametes from a female and one from the male. And the two would combine. So in chromosomes, we'll say this one brings 23. So we all have 46. But the sperm has 23 and the egg has 23. So the woman produces the egg and the man produces the sperm. And the two of them combine 23, 23 to become 46, a complete being. And that is how we are all formed. And even in that process, occasionally things go wrong, because you may have an egg that has a problem or a sperm that has a problem, and the results is something that there's not 46 but 47, or funny
The
things like
extra
that,
chromosome.
or 45, and all those cause cause problems. But essentially, that is how we all start, and then multiplication occurs, and every day it multiplies. So from the 2 becoming 1, and the 1 become 2, and the 2 become 4, and the 4 become 8, and it grows that way exponentially until a baby is formed.
Interesting. I mean, hearing the basic man and woman, obviously we know not every man and woman can make a child. What is it exactly that makes it difficult for people to conceive?
Okay, so generally, under most circumstances, we say that half the time, the reason why they're not having a baby is a problem with the man, and half the time is with the woman. It's approximately 40%, 40%. Then 10%, both of them have problems. Another 10%, we don't know why. So for the woman, which is what I tend to work with more often, the problems arise either from the egg being faulty or insufficient, and that's one thing we really need to talk about. The egg has to pass through the tube. The tube needs to be open for the egg to pass through and meet the sperm and come into the womb. And the womb itself needs to be in good health. There shouldn't be any masses inside, or polyps, or fibroids, or IUDs, or family planning things that are stuck inside. Because all those things can prevent a pregnancy from happening. With one of the biggest problems that I face is the lack of understanding that women have, or the understanding that women don't have. Recognizing the fact that your eggs are born with you and as old as you, and every day you are losing thousands of eggs. So the general thing is you are born with a certain number of eggs, but every day you are losing eggs.
Are we born with the same number of eggs?
You are born approximately the same number of eggs.
Okay.
But what happens is that once you get to the age of puberty and you start releasing eggs, the egg that you release is gone. But several eggs in that cohort too die with it. So the end result is that by the time you hit 35, your number of eggs that you have that are still viable fall significantly.
Okay.
And by the time you hit 40, it falls precipitously.
Okay.
So the assumption that I can always have a child. No, you can always be anything you want, but you cannot always have a child of your own with your own genes.
Okay.
There's a time limit. And I encourage my clients that be purposeful about having children. Because if not, the time will come where you will no longer have that option anymore because your eggs are finished. And I've met people at 29 who have no eggs. I had a patient who was 29 years and she was menopausal. She had gotten into premature ovarian failure. Thankfully, she had a child at 22. I've met people at 32 who have premature ovarian failure. And your youngest I have seen is 20.
Doc,
No eggs.
what exactly leads to, because you've given us the natural age limits where we begin to lose eggs and lose them significantly, but what other factors cause people to go into early menopause?
Some people's zone is just genetics.
Okay.
It's just genetics, things that they inherited from their. So these are the kind of people that start asking questions. Oh, when did your mother go into menopause? When did your aunties go into menopause? When did your elder sister? And you start asking those questions, and you may discover that it's a familiar trend. Occasionally, like a client I have right now, she's just the only one at the age of 40, and she's already gone into menopause. The figures are, there are blood tests that we see, and the figures are way high. Everybody has their own individual timetable. So if you see somebody who had a child at 50, for everybody who had a child at 50, there's another person who went to menopause, maybe prematurely. Right. So you don't look at that and assume that that is your portion.
It cannot be the same for every woman. I think that's a very important point because sometimes we tend to, as women, get inspired by the stories of other women. It is not wrong, but we are learning today from Doc, and I appreciate that you mentioned that we are different and we behave differently. So can I just walk into the hospital and say, for example, okay, I have a child now. I don't think I'm ready for another child. I want to wait another 5 or 6 years, but by then I'll be at this age. Is there a way medically you can tell me, okay, based on the trend we are seeing, this is the number of eggs you're losing. You can't wait till then. I mean, I'm just thinking there's a way you can do that.
Interesting question, but yes, you can. So there are tests that we can do that tells you, gives an idea as to how many eggs you have left. You understand? And there's a hormone that is secreted by the baby eggs. So we measure the hormone that is secreted by the baby eggs, and that tells us, oh, you have a good number of baby eggs left, or you don't have a good number of baby eggs. Your 5-year plan would not work. And then the other test that we can do at the beginning of the cycle that tells us, gives us an idea. So is she close to menopause? Is she quite far away from menopause? If your figures are very good, we may tell you, oh, you've got quite a bit of time. So there are clients that have come, you do the assessment and tell them, oh, we have a 2-year plan. You want to go to school and come, go to school and come. You should be fine. Should be fine. There are other clients that would come, you tell them that, no, it's not a good idea. I think we need to work on this year, because by the time you go and come, your options may not be as good. So these are all people, different scenarios for different people, but we are all made a little bit differently because based on our genetics, and what rule applies to one does not apply to another. It is a bit distressing when you're telling somebody that I think your numbers are not good, prioritize this now, and then she thinks she wants to go and do some other things first, not realizing the fact that there's no plan B for what you are deferring. Your chances later on would be pretty poor.
So for those of you who are, planning to space your children, this is vital information for you. If you don't know what your status is, just walk into any hospital. You can go to Doc at Elimas Health, and he'll gladly help you so that you can plan, like he says, purposefully. Now, Doc, you've spoken about the eggs, but what are the other things that will make it difficult for a woman to conceive?
So if the egg is produced, then the egg must swim through the tube. And the tube has got hair inside, what you call the fallopian tube. The hair's job is to pull the egg along. So the egg will be bouncing on the hair and just bouncing and bouncing and coming closer and closer to enter into where the womb itself. The hair over there can get damaged by infections. And if you get a condition that we call PID, which is pelvic inflammatory disease, it means you have an infection over there that has spread into the tubes. Now, the infection damages the tubes, makes it difficult for the hair to do its work. So your tubes can be blocked by the infection, or if not blocked, the hair inside can be so damaged that the tubes essentially do not work. So you have eggs. The eggs will enter the tube. The eggs cannot be carried to the end of the tube because the hair inside the tube is not doing a good job, and so you will not get pregnant. Or even if you do manage to get pregnant inside the tube, the baby cannot be moved into the cavity, so it ends up in an ectopic. So if you're not ready to have a baby, using protection when you're having sex is very, very important. Because it's very painful that you would have sex unprotected, maybe not get pregnant, but get an infection. And then later on, when you are trying to have a baby, because of that incident, you can't have a baby.
I was just going to ask what causes this pelvic inflammatory disease?
It's infection, bacteria.
Okay.
And bacteria that's the female canal, if an infection is in the vagina, it can enter the womb by itself. Then that infection in the vagina can be carried into the womb by sperm, and can be carried into the tubes by sperm. So the sperm can actually carry the infection inside, not achieve a pregnancy, but leave an infection there. And then the tube gets damaged, subsequently. So that is part of the reason why when somebody has pelvic inflammatory disease, it must be treated aggressively. We can give you mild antibiotics, the pain would go away. But if you treat it, because of fertility reasons, you have to treat it aggressively so that it goes down as quickly as possible to reduce the inflammatory effect, so that the amount of damage to the tube is significantly reduced. So there are so many people who have got blocked tubes, and the blocked tubes are because of prior infections. And as a result of that, we end up having to do an IVF for them, because if the highway is blocked, our only option is to go through the air or under the sea, because you can't go by road.
Are there people who are born naturally without the ability to produce eggs or make children, or even have the entire system that allows them to carry a child?
Yes. genetic problems, oftentimes. So if you have a problem with your genes, the ability to produce eggs is a problem. Then for some other people, the uterus itself, we haven't gotten to the uterus yet. The uterus itself is formed abnormally. Now the uterus is formed by left half, right half, everybody coming with their tube and their egg. The tubes and the eggs don't join, but the uterus joins. So this end is coming, and they join like this. Then the wall in between dissolves, and it becomes one tube. That one tube is uterus and cervix and upper vagina. So if there's a problem with the joining, so instead of joining like this, it can join like this. Okay. It can be totally separate and be two halves. Okay, some of them, yes, they can try and get possible to get pregnant on one half. Sometimes too, they have very great difficulties in getting pregnant or staying pregnant. For most of them, the challenge is that staying pregnant. But there are people who have had problems with their ovaries from day one. And when you examine, you discover the fact that they've had this problem and you can't do much about it. Those diseases come with some big, big names, B.
I like that, big names. But here we want to simplify it, easy to understand, easy for you to appreciate what we're talking about so you can make informed decisions. So, Doc, we've gotten to the fallopian tube where you've highlighted what the issues there could be with regards to making babies. So, continue with the journey.
Now the uterus. So, egg has gone through the tube successfully and lands in the uterus. Now, fertilization usually takes place in the tube, but we'll jump that for now. Now, lands in the uterus. The uterus is where the baby sits, what we call the womb. And there's the inner part, which is a cavity. Then there's the muscle that is on it, and then the outer part. The inner part it's like this most of the time, but it can expand to this. If you put water inside, it expands to look something like this. If there's anything inside there, when a pregnancy lands, the two of them can't stay. Usually the thing inside there is a more permanent thing, so the pregnancy comes out. So if you have a fibroid sitting in that cavity, the fibroid is fixed. You are the outsider coming in.
The visitor.
The visitor, you will go. If there's a polyp, and a polyp, to describe a polyp is like your tongue in your mouth. So assume that your mouth is supposed to be just your mouth, no teeth, no tongue. And then you have teeth, you have a tongue inside, floating inside like this, and knocking every pregnancy that comes all over the way. Now, the polyp prevents your pregnancy from implanting. The fibroid prevents it. And if, for example, the patient has an IUD, an IUD's job, that's how it prevents pregnancy, essentially, is that it prevents implantation. Then there are other things too, but it prevents implantation. I've had a patient who they took out her IUD, but it got broken. So the IUD comes as a T, and when they took off this part and left this. We went inside hysteroscopically, put a camera through the cervix into the womb, found this, took it out. She's had 2 children, naturally by herself. Another patient, another thing that could be inside is a fetal bone. Those who do abortions after the baby is like older than, let's say, 3 months, it's essentially they chop up the baby. That is essentially what they do. And pieces can be left behind. And sometimes there are pieces of bones left behind. I saw a video of somebody, horrible. I've had a patient, when you look at it, it looks like a piece of a broom. Even from the end, it looks like a piece of a broom. And I did a scan for her and pointed out to her that, hey, the reason why you're not getting pregnant is that you have a bone inside. She told me it's not true. She's never had an abortion before. And I'm like, madam, that is a bone. He said it's not true. So she disappeared for 1 year. After 1 year, she first said, no doctor has told her that before, so she doesn't believe me. Then she said it's not true. She's never had an abortion before. After 1 year, she came back and said she's still not getting pregnant. I don't know why she thought she was going to get pregnant, but she's still not getting pregnant. And I said, yeah, it's because of that thing inside there. So she agreed, went to the theater. We took it out. A few months later, she was pregnant. The presence of that mass inside the cavity would not allow you to get pregnant. And it can be something as small, a very tiny object. But once it's there, pregnancies don't do well, especially when it's located at the right place, at the top there. You won't get pregnant. So if there's a polyp, it has to be removed. If there's a fibroid, it has to be removed. Thankfully, we don't always need to cut you. You can go from below, through the cervix into the uterus, remove the polyp, remove the fibroid, remove whatever IUD, whatever mass is inside. Get out. We don't cut you. You go home the same day, and your problem is solved. A few months later, you get pregnant. We are all happy. So even the uterine problems can be solved. The other problem with the uterus, especially for those who have had D&Cs done before, is that the walls can stick together. And that is why there's a current recommendation now that we shouldn't do D&Cs for people who have got incomplete miscarriages and things of that sort. We should actually go inside with the camera and the telescope and pick the tissue and get out. Because that blind scraping is basically like somebody is putting his hand inside your stomach and looking for something, and he's doing this. He'll get some, he'll miss some, and he'll dig his fingers inside places he shouldn't put at the same time, because it's a blind procedure. Now, we've done that for years. But if you're on the other side where you have to repair the damage caused by that procedure, then you start worrying that this thing is causing a bit too much trouble. I do my best never to do an evacuation for a patient because I have to fix the damages caused by evacuations by other settings, and it's too much trouble. Because unfortunately, some people, the damage is so extensive, they will never get pregnant. So all these, and if the damage is extensive, you may have no periods at all. And that's what they call an Asherman syndrome. So if they've told you have an Asherman syndrome, that is where it came from. So all these are things that affect just the endometrium, which can make it difficult for you to get pregnant. And if you're older, the endometrium must be a certain thickness. And the older you get, the more difficult it is to get to that level of thickness. And it has been found that you need to be that thick before when a pregnancy sits on it, it would stay. Right. It's almost like the princess and the pea. It detects the fact that, hey, too thin, hard things under it, I'm not going to stay.
Right. Interesting. So beyond the uterus, any other
So we spoke about the egg, we spoke about tubes, we spoke about the uterus, and then we jump to the man.
Okay.
So for the woman, these are her major issues. For the man, of course, about the egg, there are those who don't release eggs for hormonal reasons, PCOS and those things, which can be fixed. But they also have problems with ovulating. They don't ovulate every month. So they are still on that side. For the man, we need a certain number of sperm. We need the sperm to have a certain amount of handsomeness and a certain amount of activity. So sperm that when you put them here, they don't move, they are useless. Honestly, they don't do anything. Sperm that move, they must move forward with progress and activity and not be moving side. Like those sperms that are unfocused, they are also not helpful. But the target is ahead. All this side action, it doesn't give you anything. So that is another challenge. So even with the motion of the sperm, they must move, and they must move forward with purpose. So that's what we call active forward linear progression. It must be moving in a particular direction. The sperm must be of a particular quantity, because we found a quantity that we say if you have that quantity of sperm, and we look at the number of that are active and the number that are handsome, the end result gives us a certain number of sperm that we know we need to fertilize. Now, getting pregnant is actually one sperm and one egg.
Yes.
But there's a reason why a man produces 20 million sperm in ejaculate, 40 million, or as some guy that I know, 400 million.
Wow.
Per mil. You can't tell, you won't finish. 400 million sperm, one human being. And that's the challenge. But for him, can you imagine somebody with that sperm count and he comes and says he's trying to get pregnant and they are not succeeding? And that is a problem for them. Thankfully, he had a child. Some other people, the sperm don't look normal. So sometimes the sperm has got 2 tails, 2 heads, an abnormal midpiece, swollen heads. All those are abnormal sperms that if they fertilize an egg will result in an abnormal baby. Some people have got too many of those. Some people have got sperm that the DNA of the sperm itself is damaged. And the result is that the sperm is not able to do its work well. And then there are some sperm that can't enter the egg. Like we see in Legon, they have POP. So they reach the egg, and they are not able to convince the egg to open the door for them to enter. So no matter what you do to the sperm, they can't enter. Those are the sperm that you can take and inject them inside when you are doing IVF. Okay. So there's a process by going there. So there are various things we can test with the sperm, and then based on the outcome that we get, we know that this is the problem or that's the problem, and then we can intervene. So whilst having a baby looks like, just have sex and have a baby, all these things have to happen in the background for the sperm to successfully meet the egg Then we have to look at the environment inside the woman. And if the environment is poor, abnormal hormones is a problem. She has medical conditions that creates a poor environment is a problem. All those things make it difficult for the pregnancy even to implant.
Doc, we'll be back to talk about the other 10% that you said you just may not know why conception is not happening, because we live in a very spiritual climate when people have a lot of wonderful ideas. We'll be back to, try and deal with all those myths, as well as speak extensively about the interventions. Thankfully, because of the advancement of science, even if you have certain conditions that make it difficult for you to conceive naturally, you can do so with the help of science. We'll be back to discuss all that. Please don't go anywhere. Welcome to the Baby Doctor with me, Bernice Abubedu-Lansah. We are all about making beautiful babies and helping them grow to create happy homes and families. Today, I am here with Dr. Paddy Ayete, and we are talking about preconception, all the important things you need to note and do to create that environment for a healthy baby. We'll continue our conversation. We've had a lot. If you missed anything, you need to catch up, because it's been a lot of important information Doc has shared. Obviously, 20 years of experience is not a mean achievement at all. Doc, let's talk about the 10% that science cannot tell why. Because I've heard women share testimonies about how they were looking for a child and the doctor says, there really isn't anything wrong. We don't know why you're not making a baby. How do you deal with that?
First of all, pregnancy is a probabilities game. So assuming everybody is perfect, 10 perfect people having sex at the right time, 2 will get pregnant. That's about 20%. So that's why we tell you, oh, try for 6 months or 1 year before we start giving you treatment, because we know that eventually it works out for most people. So a lot of times, yes, we try and drill down to find out why. And sometimes you can just figure out the why. So I saw somebody yesterday, was it yesterday? Yeah. And their problem was that they tended to have sex, they tended to start having sex on the day after ovulation. So if you look at their timetable, this is when if you calculate the day they had sex, it tended to be the day after ovulation was over. So they were consistently missing the date. Now, until you discover that, it is an unexplained cause. So for a lot of times, there's a reason. We just haven't figured out what the reason is. And the assumption that, oh, ABC, this works most of the time, so it will work for everybody. It doesn't necessarily, work that way. So then there are those that, you are asking about the spiritual ones. There are those that, and I'll give you an example of the spiritual one. There are those that every time it reaches ovulation, they have a quarrel. I can't use science to explain that one. They are fine in their house.
Okay.
Day 12, 13, 14, big fights.
But couldn't it be because of the woman's hormones? Because, could it be that when she's just getting to the point of ovulation?
The woman knows she is the one who is very aggressive about having the baby.
Okay.
She knows
that
this is not the time to pick fights.
Okay.
I need something from this man. Big fights.
Mm.
And then after ovulation ends,
they make peace.
They make peace. And when you ask them, what were you fighting? I've had an occasion I asked them, what were you fighting about? Both of them said they couldn't remember.
Okay, now that's weird.
Both of them said, what is it about? Because we just knew we were fighting that week. Now, if you start fighting that week consistently, I can't use science to explain that fight. I can't use medicine and fertilization to explain why you guys didn't have sex at that time. But there's something in your house that is ensuring that you're not meeting at the time you should meet. So they can have sex throughout the month, all the other times, without a fight. But the moment it approaches ovulation, a quarrel will happen. A quarrel that is so insignificant, they don't even remember what they were quarreling about later on.
But it's so important enough to
stop
time. Them from doing what they need to do. Interesting.
Yeah. I had a friend who it was time for him to do the thing. We've done the scan. We've checked the thing. Oh, the egg is good. So in 2 days to be ready. So he told me he's going to Kumasi to see somebody about some meeting in Bid House. I'm like, oh, buddy. Action time. So it's very important that he goes. He went.
Do you find that sometimes it's just a mindset problem? People may just not be relaxed enough. So there's a lot of apprehension because, usually people are not told, go and do this to make a baby. But once you're told, it becomes more like a chore. I remember watching a movie and the guy was like, I don't like, it's almost like I'm hearing the doctor tell me to do it. I don't want it that way. I want to do it when I want to do it, how I want to do it. So it's almost like it's a chore for them. It's more of an instruction. It's not a nice experience for them because it's a chore, basically.
That is easily solved. Very easily solved. It's in the hands of the woman. Don't tell your husband. Do not tell him that this Wednesday is ovulation. Don't tell him. If you know Wednesday is ovulation, from Friday, start being nice to him. Then on Monday, then you go and collect 1B, coolly and put it down, knowing that Wednesday is target. Then Tuesday, you are extra nice to him, but you don't do anything. Then Wednesday, no, then you make sure that you get your Wednesday. So just in case a meeting crosses you on Wednesday, you had your Monday. And sperm can live for 5 days inside the uterus. So if you have your Monday, there will be sperm there on Wednesday. If you have your Wednesday, there will be sperm there on Wednesday. If you have Sunday and Tuesday, there will be sperm there on Wednesday. Just don't tell him. No man likes performing on command. They are like, hey, Bessie, I need sperm from you. Come and produce the sperm. Charlie, like he said, he's thinking about the doctor. It's very
uncomfortable.
He has to perform on command. It's not the kind of thing you can perform on command. So it is disturbing and distressing. But if you just don't let him know that this is the time and you are nice all the time, you know what to do.
Right. Doc, before we go into the interventions for people who may have tried all the remedies and gone through all the processes naturally and not be able to conceive, there's something that excites my curiosity. And it has to do with how I have observed a lot of young girls taking pills to prevent pregnancies.
The wrong ones.
Okay. So you walk into a pharmacy, you see a young girl, and this is a personal experience. I had gone in there to buy some medication, and the very young girl walks in and says, give me this particular brand, a very common one, of an emergency contraceptive. Then I asked the pharmacist when the lady left, do you know that there is a way to take this thing, and you can't abuse it every time because it's there? Do you educate these young girls when they come? My question to you, Doc, is, are there repercussions or for young people at this time who may think, I want to have all the fun and not get pregnant and not even know how to properly administer these medication, is there a repercussion in the future?
Yes, there is. First of all, the fact that she's using emergency contraception means she's not using a condom.
Yes.
If she's not using a condom, she's exposed to HIV, hepatitis, PID, and think about it. I don't think they realize it. You had sex with this maybe irresponsible gentleman, and he gave you a PID. Then 10 years later, you find your perfect man, and you get married to him, and you can't have children because you forgot to use a condom at that time. And that guy who had that infection proceeds to meet somebody and get her pregnant very quickly before he even gives her a PID, and she has children. Or he gets treated along the line, and so doesn't give any infection, and he proceeds to have children. And you are paying the price. And he's gone. He's living his life and left you with this. The number of young people who have got HIV, that you come to a clinic, this is that, maybe procedure, antenatal, trying to get pregnant, whatever it is, and we discover that, oh, you have HIV. Now we have to counsel you, arrange for a clinic for you, all that kind of stuff. It's difficult. And all this could have been prevented if you had worn a condom. People are more afraid of pregnancy than they're afraid of dying. So first of all, that's a big headache. Then the second part. Now, emergency contraception is designed for, you use the condom broke. Most likely you will get pregnant. Let's see if we can reduce the chance of getting pregnant by a bit. Therefore, we give you the emergency contraception, which is to try and prevent the pregnancy from implanting. It is like driving a car, not using your foot brake, but choosing to use your handbrake for your entire drive. But because you can just go to the pharmacy, pop it, take it, people think, oh, it's okay. Now, of course, it's going to affect your cycle. So your hormones are going to be affected because the normal way your hormones should go, it will not go that way because of the emergency contraceptives. So you're going to have this cycle up, cycle down, cycle up, cycle down, can mess up with your ovulation. And they don't realize it until, years later when there are issues. Then at some point in time, it may come out, if they even remember that they were abusing this medication. The purpose is that your main contraception has failed. Or, for example, somebody gets raped, and we are trying to reduce the chance of getting pregnant. And that is why we are using it. Its effectiveness is if you take it within a certain time period. And its use is when you are taking it when you had sex around the time of ovulation. Unfortunately, some people are taking it even when their period is about to come because they've had sex, in the puppy, when they actually didn't need to take it because they don't understand how cycles work. But it is not helpful. And for the young people of now, I'm worried about what will happen 10, 20 years' time when these people are going to start manifesting the consequence of their current lifestyle. Not good.
If there's anything you learned today, it should be that even for people who may not be young but just don't know how well to use this, you may just want to speak to your doctors or any health practitioner where you live about the right way to take emergency contraceptives, seeing how they link to your ability to conceive naturally and all. Doc, let's now zoom into medical interventions. I'm excited about it because when you hear stories of how people have used, modern technology to have a baby and the joy that you see on their faces when they come to church to dedicate their children or when they're talking about their children, it just shows you the precious nature of making a child and the joy it brings is like no other. Thanks to science, people who would have been written off maybe 100 years ago, can now be called parents and they're excited about it.
Mother's Day.
And they're excited about it. Run us through the available options.
Okay, so if you're having difficulty getting pregnant, you should see a doctor, preferably a fertility specialist. And he shall examine your ability to produce eggs if your tubes are good, if the uterus cavity is good, and if the sperm is good. Once he's done that, usually takes about a month because we test you at different times of your period. So you just can't come any day and then there are tests that we run first 3 days. There are tests that we run in the middle of a cycle. There are tests that we run around 21 days after your period, from the day your period started. When we've done all those, we do the full assessment. We'll do scans, we'll do hysteroscopies. Then we have an idea as to what the problem is. Now, let's start from egg problems. Assuming for the majority of egg problems, actually, are not that there are no eggs, but the eggs are not being released. And it's a condition called polycystic ovarian syndrome. When we were in school, we thought it was not common. It is common, Papa. It's the commonest hormonal problem in the world. And that is the woman has an inability to release her eggs. Now, it comes with other manifestations, so that's why it's called a syndrome. So now I can look at your face when I meet you and I know that you have this problem. And I haven't examined you, I haven't spoken to you, just by looking at your face. There are other things that we can use to observe and know that this is what your problem is. Today, a woman came to the clinic and she said, oh, doctor says I have PCOS. I said, okay, that problem is solved. Now tell us the next one so that we can address it. Because now we've reached the point where we can say, if you have PCOS, we can fix it. Now, it's a problem inside the body. You need to address that problem, fix it, and the moment you fix it, the person can now start ovulating properly. When they start ovulating properly, you can help them to get pregnant. When they do get pregnant, PCOS people have another problem. The first 3 months, they tend to lose pregnancies. So you now have to block that one to ensure that they keep their pregnancy. When you succeed with that one, they have another problem again, which is between 4 to 6 months, they lose the pregnancies again. There's another reason for that one. So take notes. You have to help them get pregnant, help them ovulate, then help them get pregnant, then solve their problems that make them lose their pregnancies in the first 3 months, then solve the problem that makes them lose pregnancy between 4 to 6 months. Thankfully, the 4 to 6 months part is the most difficult. Thankfully, now we can fix that one too. And the result is that you can actually succeed in getting pregnant. There's a story in the newspapers on the media recently about this lady who said she had lost 5 or 9 pregnancies, and she had to stay with her legs in the air, and she had to be pregnant. When I read the story, I was like, well, I know what this is. I knew exactly what her problem was, and I knew the solution that should be given to her. And if you get used to it, it's my area of specialty. So if you know, you can actually tell the signs. The moment they start, you know what the problem is, and you know where the stumbling block is for it to fix it. It's not always easy getting them pregnant because you can correct their hormonal imbalance, but actually getting pregnant, the other factors now come into place. Because all you've done is brought them from a hormonally negative point to a hormonally positive point.
Right.
Now they are like everybody else. They now have their 20% chance that we have to work with. But it is possible. So PCOS, you can get them to ovulate. We can get them to ovulate. We can get them to get pregnant. We can get them to stay pregnant until they have their baby at 9 months. Before, the focus was that stitching the womb. There's actually a better way. You don't necessarily need to stitch their womb for them to get pregnant and to stay pregnant. So that is for the PCOS people. For those who are old or older or have run out of eggs, then the donor egg option exists for them in IVF, which is we do an IVF for you, and we use a younger person's egg to combine with your husband's sperm, and we put it inside you.
Those options are available in Ghana?
Or available in Ghana. Or we take, or if the sperm too is the one that has a problem, we take a younger person's sperm, combine with the egg, and put it inside you. It's possible. We are an equal opportunity person. We do both sides. So that option too is available for those who don't have eggs at all. For those who have a problem with the tube, we generally have to go around the tube. If we think the tube cannot be opened, there's a process by which you can try and open the tube. It doesn't always work as well as it should. Sometimes the fastest way to get pregnant is just go around it and go by an IVF and achieve a pregnancy. So that option exists. Then for those who've got problems inside the uterus, adhesions, fibroids, polyps, stuck IUCDs, things inside the uterus, we do what you call hysteroscopic surgery. We put a camera inside through the vagina, through the cervix, into the womb. Then we do a whole operation inside there and remove all the fibroids that are in the middle of the womb, where the baby sits. If there are polyps, you remove it. If there are adhesions, you cut it and recreate the way the womb is. And then when you finish, after you've removed the fibroid or the polyp and adhesions, then you come out, and the patient goes home the same day. We do it without cutting you at all. And we do it every week. And tomorrow I have plenty to do. So those are the kind of things that are available, interventions that are available. And thanks to technology, the fact that you have any of these problems is no longer you cannot get pregnant. The one that we have challenges with is when the lining is refusing to get thick to put a baby inside. Some people, it's really difficult. You give them medications, they don't respond. That's still a work in progress till we can find a technique that works, consistently.
Even that some can use surrogates.
Yes. So good point. So for those who the uterus is just not good enough, the best option for them is a surrogate, in which you recruit somebody who will carry the pregnancy for you for 9 months and give you your baby.
And that's also available in Ghana.
That's available in Ghana. Everything I've mentioned is available in Ghana. Everything I've mentioned is available in Ghana. PCOS treatment, IVF, freezing embryos, donor egg, donor sperm, surrogacy, all available in Ghana.
I hope we've given you some hope if you're someone who's looking for a child and has tried all the options and can't get your head around it. I'll be back to wrap it all up with Dr. Ayete here, but here are your tidbits for today.
Preconception. Plan and take action. Seek professional guidance. Maintain healthy diets. Exercise regularly. Remember, getting early and regular prenatal care improves the chances of a healthy pregnancy.
And those were your tidbits for today. It's been a really exciting conversation today. I'm happy to help you to spread knowledge, and I've been doing this with Dr. Paddy Ayete. He is with Elimas Health, and they are into everything obs and gynae. One of the best you can find in the country, okay? They're located at Airport Residential Area. You can find them, call the numbers on your screen, pick up the location, pay Doc a visit and tell him that you saw him on the Baby Doctor show. Who knows, you could get, some, you know what I mean? So Doc, in wrapping up this conversation, what would your message be to that person who wants to make a baby or that person who aspires to have a child, basically wrapping up and summarizing what we've discussed today?
Options are, for the person who is trying to have a child, options are available. All hope is not lost. There are, a variety of options. The things that I mentioned of the treatments that are available in the country, we offer that service at Elimas Health. There are other institutions too that offer that service. So it's available. You just have to decide as to what you want, and it's our job to find a way to make it happen for you. For most people can be helped. Most people can be helped. And if A doesn't work, B can work for you, or C can work for you, or D. So it is possible for you to have a child. There's hope.
I like that. It's possible. So why not give it a try? Visit Elimas Health. It's been really an exciting edition of the Baby Doctor Show with me, Bernice Abu-Baidoo-Lansah. Let me say thank you to Dr. Paddy Ayete of Elimas Health. You can find Elimas Health at Airport Residential Area, number 10A Volta Street. The numbers to call are rolling on your screen. Pay Doctor a visit and tell him you saw him on the Baby Doctor Show. He'll treat you very well. Trust me, I know that. And we have been bringing you the Baby Doctor from Think Studios here in Accra. Think Studios is a creative agency. Anything you need about creativity, your shows, Think Media will be there to help you. And let me say thank you to Azel Vogue for my beautiful shirt. You can find Azel Vogue in Dansoman, or you can visit her Instagram page, Azel Vogue, and reach out to her. She's got really beautiful designs for all occasions. Once again, let me say thank you. God willing, next week we are back with another exciting edition focusing on the next step, which is conception. It's a very important discussion you don't want to miss. Thank you once again, and enjoy the rest of your day.